Why is diverticular disease so common in Western countries? Imagine a busy city where the streets are narrow and crowded. That's similar to what happens inside the colon of many people in Western countries. Diverticular disease, which includes small pouches called diverticula forming in the colon wall, is much more common here than in other parts of the world. But why is that? Let's explore the factors behind this trend. In Western nations, diets tend to be low in fiber. Fiber is found in fruits, vegetables, and whole grains, and it helps keep stool soft and easy to pass. When fiber intake is low, stool becomes harder and more difficult to move through the colon. This causes increased pressure inside the colon walls, which can lead to the formation of diverticula. Think of it like a balloon that gets stretched when you blow air into it. Over time, the colon wall weakens at certain points, especially where blood vessels penetrate and small pouches form. Another big factor is aging. As people in Western countries live longer, the chances of developing diverticulosis go up. The risk increases with age because the colon wall naturally weakens over time. By the age of 80, up to 70% of people may have diverticula, often without even knowing it. Obesity and a sedentary lifestyle also play roles. Being overweight and not moving enough can increase the risk of developing diverticular disease because these factors are linked to higher pressure in the colon and weaker muscles. Genetics and race may influence where diverticula form and how common they are. For example, some studies suggest that African Americans may have different patterns compared to Caucasians. In Western countries, diverticula mostly develop in the sigmoid colon, which is the lower part of the large intestine. Interestingly, in Asian populations, diverticula tend to be more common on the right side of the colon, likely due to genetic and dietary differences. Most people with diverticulosis do not experience symptoms. However, about a quarter of those with diverticula may develop complications like diverticulitis, which causes inflammation and pain. Bleeding is another concern, happening when a blood vessel within a diverticulum ruptures, leading to blood loss. While many episodes of bleeding stop on their own, some requiring medical treatment or even surgery. The rise in diverticular disease among younger adults in Western countries is also concerning. These individuals may face more severe complications and need more aggressive treatment. To help prevent problems, doctors recommend eating a high-fiber diet, staying active, and maintaining a healthy weight. Once diverticula form, they do not go away, so management focuses on preventing complications and treating symptoms early. If you notice persistent abdominal pain, fever, or rectal bleeding, it is important to see a healthcare professional promptly. Proper diagnosis and treatment are essential to avoid serious issues like infections or perforations. Remember, understanding your risk factors and making healthy lifestyle choices can make a big difference in managing diverticular disease. Always consult your doctor for personalized advice and stay informed about your health.